Welcome everyone to our second webinar with DrFirst and iPrescribe. As you know, the Indiana passed a law that effective January 1 of 2021, we have to send all of our controlled substances by an e-Prescribe. I did get a notice from a doctor that on the federal level, the CMS has extended their deadline till next year, January 1 of 2022, but the state of Indiana is still putting in the restrictions on us to send electronically, so it still applies for here for the state of Indiana. So I would ask you on your DrFirst questions, either put them in the chat room, in the public chat as a question, and then I'll go through them at the end, or if you want to do it privately, you can send it to me, Ed Rosenbaum, and I will get those, and we'll save the questions for the end. Otherwise, everyone's muted except for our DrFirst presenters. So with that, I'll turn it over to Liz. And Liz, welcome for our second webinar. Thanks for joining us.
Thanks so much for inviting us. And I will apologize in the beginning if my dogs bark. I don't have children, but I do have dogs. So let me begin by talking a little bit and introducing you to our DrFirst team here today. Dr. Charles Chen is a practicing periodontist in the state of Maryland and is a co-founder of DrFirst. Dr. Mike Kaminsky is a recently retired dentist, also from Maryland, and a DrFirst consultant. Megan Bowman is our product manager for iPrescribe, and Aisha Faisal is one of our implementation specialists who works hand in hand with providers such as yourself to implement our products into the workflow of your practices. I am just an attorney, senior director for strategy and regulatory programs here at DrFirst. I think now we'll advance the agenda for today, where we have Aisha. Yes, thank you. So we are just going to give you a quick overview of DrFirst, a very short overview of EPCS in the States, and talk about the Indiana EPCS mandate. And then Aisha is going to walk you through an iPrescribe demo, and also is going to address issues around the onboarding process and the use of our partner ID.me. And then, and throughout this exchange, Dr. Chen and Dr. Kaminsky will add their commentary and additional input. So with that said, I do need to read this disclaimer, which specifies that our presentation contains publicly available information concerning the electronic prescription of controlled substances. Nothing herein shall constitute legal advice, and it is therefore recommended that all participants confer with their legal counsel or advisor regarding the application of these laws to their business settings. Next slide, please. So DrFirst was founded in the year 2000. We're headquartered in Rockville, Maryland, with a satellite office in Mesa, Arizona. We were amongst the first, and our flagship product, Arcopia, was made available in the mid-2000s for the transmission electronically of prescriptions. Because of our early work in this area, the DEA, as it was beginning to develop its rules for the electronic prescribing of controlled substances solution, chose DrFirst to be the beta test vendor for those rules. And so I like to say we were the first company in the US to actually have a DEA certified EPCS solution. And so as a result, many EHRs chose, rather than to develop their own solutions, to embed our e-prescribing software into their EHRs. As a result, we are embedded in over 270 EHRs. We have over 121,000 prescribers sending electronic prescriptions every month. We have 113 million prescriptions being sent by our prescribers annually. We have over 324,000 healthcare users that use either e-prescribing or other solutions we offer. And we work very closely with over 1,500 hospitals nationwide. Next slide, please. So e-prescribing for legend drugs was first authorized in the mid-2000s, 2007. And as a result, really took off. And so these bar graphs show that in recent years, prescriptions overall being sent electronically have increased rather dramatically, particularly those that are being transmitted for legend drugs. Now, that same is not true for controlled substances, and there are a number of reasons for that. There are additional rules around identity proofing and two-factor authentication that the CMS and DEA required as part of e-prescribing for controlled substances in order to protect against diversion and fraud. And some of that you're going to get to engage with Aisha on a little bit later on when we talk about our onboarding process. But just remember, these are rules that are designed to protect the identity of the prescriber and to assure that the appropriate DEA prescriber is the one transmitting the prescriptions. But so we have lagged somewhat for EPCS in recent years. And as a result, a number of states implemented mandates. Next slide, please. And I'm from New York. We were the first state to mandate electronic transmission of prescriptions for both legend and controlled substances. Now, that's not going to be true for you, but it is true here in New York. But as you can see, this graph shows the fact that after the mandates were implemented by these 11 states, there was a concomitant rise in the utilization and the transmission of prescriptions for controlled substances. Next slide. This shows the country and the state of affairs as of today. We have 11 states, those in orange, who have already implemented an EPCS mandate. We have 11 more, including the state of Indiana, that will implement on January 1st of 21 an EPCS mandate. We have 4 more who will implement a mandate before the end of 2021, and 3 others who will implement a mandate as of 1/1/22. Next slide. So these are the specifics of the Indiana EPCS mandate. As I indicated, and I know you know, January 1st, it goes into effect, and it applies to any controlled substance 2 through 5. And they must be transmitted electronically between your EHR and pharmacy. These are the notable exceptions to your mandate. I will note that the ones that are most utilized are the prescriptions that are going to be filled by out-of-state pharmacies, and where the prescriber and dispenser are the same entity, or where a prescriber has applied for a 1-year initial waiver due to economic hardship, technical difficulty outside of the control of the provider, and exceptional circumstances. And next slide, please. And as Ed noted, the federal mandate, it will go into effect on January 1, 2021, but the compliance date has been extended to January 1, 2022, which means they won't penalize anybody who doesn't have that in effect. Now that, as Ed noted, that only applies to scripts that are issued for Medicare Part D beneficiaries. The state mandate for any 2 through 5 controlled substance goes into effect on 1/1/21. Next slide, please. I will, last slide on my behalf, I will note that the Indiana Inspect program does have a grant program if providers need some assistance in financial assistance in purchasing an EMR or standalone e-prescribing system. And I'm proud to note that DrFirst e-prescribing systems are on the approved list of the Inspect program. If anyone has any questions about that, please feel free to query me. My information is at the end of this presentation. Next slide. Aisha, I believe you are up.
Actually, Megan was able to get in, so she's going to do that.
Okay. Megan, welcome.
Thank you. I worked with our support team here to hack into my own computer that I got today, so I am here. I'm sorry about the delay. So it looks like this is the host disabled. My screen sharing. I don't know if I need to.
Okay, yeah.
Megan, I think we'll need to find you to make you a co-host.
Okay.
Is it Megan Avery?
It's Megan Bauman.
Okay.
She's actually showing up as Ed Rosenbaum.
Yeah, she's on my name, Janelle. So
Oh, sorry. Gosh, she's adding complexity everywhere I go. Sorry about that. Okay.
I don't know, while we get Megan up, Dr. Chen or Dr. Kaminsky, if you have any insights at this point in time you'd like to make for the group?
Well,
Mike and I have been talking, and we want to compliment Ed and your whole state organization. You guys being very, very efficient, get the project up and running. It's more efficient than any other state we've encountered. So I want to compliment to you and your organization.
Well, thank you. I don't feel very efficient right now at this moment, but thank you, Dr. Chen. That's gracious of you to say so.
I want to respond to a question that Ed sent me after our first presentation, which had to do with the amount of time it takes to register. And we were saying that the average time is, 10 to 12 minutes. What we didn't realize is that the company ID Me, which does our security, which verifies the identification of each provider, is under a lot of pressure to help different states with their unemployment claims. They've got $1 billion in unemployment claims through various states that they're trying to help with the identification. However, DrFirst has been able to work something out with them. So hopefully, as you do register, and we are going to go through the ID Me later in the presentation, you should be able to get in a little quicker. And again, that's something that's out of our control, but I think that we have made arrangements will make it a lot easier for the registration.
Do we have Megan up and running yet?
It's blocking my screen. I believe I got a brand new computer today, and I have all these security settings, and I think it's blocking me. So I'd have
you should just do it.
Drive. Yeah, and we can both speak to it, but Aisha might have to share her screen. I'm sorry.
That's okay. So Aisha, can we go back to you?
Yep, that's fine. I can pull it up. And Megan, you can interject and let me know if there's anything else you wanted to add. All right, let me pull it up. And thank you, Liz. Thank you all for your time today. My name is Aisha. I'm on the implementation team here at DrFirst, where we innovate provider-centered solutions. So today I'll be demonstrating iPrescribe, which is our mobile e-prescribing solution. And it's a tool that's pretty simple, it's powerful and pretty fast. iPrescribe can be downloaded on your mobile device or tablet from the App Store, whether it be Android or iOS Apple devices. And once downloaded, you're prompted to log in or sign up. We partner with ID.me to verify provider credentials and get you onboarded. So once you have your credentials, you can just log in to the start of your prescribing workflow. And as you can see, once I log in, I'm taken right into this new RX screen where I can start prescribing. If you have multiple practices in multiple locations, you can toggle between these practices by going into this top left hover menu, and right below your name, you'll see all the practice locations that you might be associated with. So if I just switch into another practice, it'll let you know that you're switching to a different location and your patient population will be different. Before we get into prescribing, I wanted to go over some of the tiles here. The pending tile will have prescriptions that are waiting to be sent off to the pharmacy. Your clinical staff members can queue up prescriptions for patients, and you'll get a push notification on your phone when they do so, letting you know that there are prescriptions that need to be sent to the pharmacy. So if you just click into there, you'll be able to see all the pending prescriptions for your facility. And you can bulk approve all of the medications. So if you just click approve, and as you can see, this is a test environment. So we have a bunch of test prescriptions here, and you can click approve, click next, and the prescriptions are then sent off to the pharmacy. Additionally, you can give some members of your clinical staff the ability to be a provider agent, which will allow them to send non-controlled substances on your behalf. and you'll be given a list of medications they sent to acknowledge. So this kind of alleviates some of the workflow off of yourself and lets you entrust individuals to queue up prescriptions, whether it be nurses that are queuing up refills or, you know, maintenance drugs that your patients are taking, then they can do that way. And at any time, you can click this iPrescribe tile to be taken right back into the home screen. The next tile here is the renewals tile, and this will show you pharmacy messages for renewals where you can change or approve the request or send it to another provider if need be. So this is where you'll be seeing all your refill requests, any change requests, and messages that are coming in from the pharmacy. And then the next piece here is secure chat. And this is going to launch you into our backline secure HIPAA compliant secure messaging app, which allows you to communicate with staff members and external patients or contacts. The PDMP tile will show you information from the controlled drug database where you can view PMP data on the go instead of having to log into your state's portal. So this information is available through this icon here. Where you can type up the patient's name and look for their PMP record, or you can see this in the prescribing workflow as well, and I'll demonstrate that shortly. And so as you saw, I just typed in the patient's name into that PMP tile, and I can see their prescription, controlled substance prescription history. And then we'll go into the prescribing workflow here. This is just clicking new RX and you can get started. When you first log in and register for iPrescribe, you'll have the option to use our patient finder functionality. Patients can be loaded using patient finder feature enabled upon sign up. So because DrFirst has connections to many EMRs, insurance and payer data, as well as the SureScripts network, we're able to find your patients based on your prescription prescribing history to prevent manually creating them. At any time, you can also manually create a patient by clicking this Add New Patient button. But our prescribers find Patient Finder to be helpful because it gets them up and prescribing in minutes. And then with our dynamic search function, as you start typing a patient's name, a list of patients that match your search criteria will start populating. And then we can click on the patient's name to be taken to the patient's profile. At the very top, you'll see the patient's demographic information. All the required fields will be asterisked, and for controlled substances, you'll also need to enter their first line of their address. And then the next section here is the pharmacy. A patient can have up to 5 pharmacies listed on their profile. The first one is their default pharmacy, and any pharmacies added after the 5th one, the last one just falls off and the new one takes its place. So you can click into the patient's pharmacy and choose from the ones that are already attributed for the patient, or look for another pharmacy. So we can click find another pharmacy and search through our database of pharmacies. We have over 65,000 plus pharmacies in our system, so you shouldn't really have any issues finding a pharmacy, but if you ever do, whether it's a mom and pop pharmacy that might not be in the system, our 24/7 support service can assist you or assist the pharmacy in getting into the system as well. So I always recommend that you type the first 3 letters of the pharmacy you're looking for and then narrow by the city, state, as well as the zip code and any other filters that you see here in terms of mail order, 24-hour, or EPCS enabled pharmacies. And once you click search, a list of pharmacies that match your search criteria will show up. They'll all have tags next to them, which indicate which services this pharmacy offers. So if you click on the tags here, it'll let you know what it is. So retail, EPCS enabled, open 24 hours, and accepts electronic prescriptions. And then you can just click on anywhere on this pharmacy name to add it to the patient's profile. Next, you'll see the PDMP record that I showed you within the PMP workflow, the PDMP tile earlier. You can also see it within this workflow when you're on the patient's profile. So if you click view, you'll be able to see their record as well. The next section here is active medications. This has two components to it. The first piece being the list of active medications that you as your facility can reconcile. So during intake, when you're asking patients which medications they're currently on, you could add those medications into this active medication section. So these are the records that have been reconciled by you all. We also have a med history piece, which uses SureScript's data in order to pull the patient's prescription history, whether it be from you or from other providers as well. So if you pull that record, it'll show you a year's worth of prescription history data for this patient, and you'll be able to see what it is that they get prescribed elsewhere. And this is coming in from payer data and pharmacy fill data from the SureScripts network. And then next we have the pending section, which will have pending prescriptions that are waiting to be sent off for this patient. And then allergies and diagnoses. So allergies can be added here. If you click this add button, you can select the allergy, the severity, the reaction, as well as onset date, as well as diagnoses that this patient has. And we do support ICD-10 and ICD-9 codes. So if you ever wanted to add these information in, it's very useful because we do have clinical alerts that will allow you to make a clinical decision support decision. So it'll give you allergy alerts as well as drug to diagnosis alerts, drug to drug alerts. We have up to 9 clinical alerts in our system, but it's still up to you whether or not you'd like to prescribe, as you are the provider. And then let's get into prescribing. So we can prescribe actually from the active medications list here. If there's a drug that you wanted to queue up from this list for a patient, and I know you guys are all dentists, you probably will never have to do this, but if there's something that they're going to take from here, you can swipe left and either click prescribe or renew. Renew queues up the prescription exactly as it appears in active medications, to be sent off to the pharmacy. And then prescribe allows you to make those changes to the prescription. So prescribe, you click that prescribe button and it will let you change the quantity, the refills, all of the prescription information. So if I wanted to make this a 90-day supply, I could change it to that. Any refills can be attributed here. Substitution permitted or dispensed as written. Any patient directions can be edited here, and additional directions can also be entered. So if it's a tapered drug or a compound medication, you can put that information in here. Diagnosis that's relevant to this prescription can be attributed here as well. This is not a required field, but it can help you down the line. Comments to the pharmacist can be written out over here. You can also have built-in comments to the pharmacist for your facility or your practice, which you can just click and go. Some things such as delivery, infusion, compound, and other use cases would be for geriatric patients to have easy caps, or Spanish directions for bilingual patients. So you could just note all of that information in this comments to the pharmacist for the pharmacist to see. Once you click continue, you'll be able to review the prescription information, and as well as see my benefit check, which allows you to see whether or not a prescription is covered by the patient's insurance. So as you can see, this is not a covered drug, and it'll give you alternatives as to what may be covered for this patient. And then you'll be able to review the prescription information, the pharmacy it's going to. If this is a clinical staff member that's queuing up prescriptions for a provider, they can select the provider from this section here. As a provider, you can sign and send directly from here. And if you, or if you're a provider agent, you can send from here as well. If you don't have those privileges, you can add to pending for the provider to come and send that prescription off at a later time. So as you can see, now it's been added to the pending queue. All controlled substances will have the schedule right next to that in red. We're going to queue up a controlled substance from scratch. So if you want to write a prescription from the very beginning without any med history or any of that intervention, You could just click Create New RX, start typing up the drug name, and this is also a dynamic search function, so as you're typing, it'll give you results that match. We'll select the drug that we want, as well as the dosage. It'll give you any alerts that are relevant to the prescription and this patient. So we have this duplicate therapy because she's already on the tramadol that you saw earlier, as well as this drug diagnosis alert that's relevant to her current symptoms. So as you can see, you can prescribe anyway or change the drug if need be, but we're going to prescribe anyway for the time being. We also have a smart sig function where it aggregates the most common way that this prescription is prescribed. You can choose one of the smart sigs or you can enter your own custom directions here as well. I'll just select one of the smart sigs here, choose the duration, quantity. Controlled substances don't have any refills, but if you did have a legend drug, you could attribute the refills there. Controlled substances will have a do not fill before date. If there was ever an instance you needed to move it to a time in the future for the prescription, you could do that here. Any substitution permitted or dispensed as written. Directions, diagnosis comes to the pharmacist just like before. Continue. And then it'll show you the My Benefit check. Prescription review, and you can sign and send from here or add to pending. I'll sign and send so I can show you all the controlled substance workflow. It will essentially be to certify that you are the provider. Click continue. You can also see the PDMP record within this workflow as well. You would approve any changes or approve the medication itself. Select the token, whether it be your key fob or your soft token on your phone, laptop, or tablet. You'd select that, enter your signing password, and then the token PIN, which is the number that regenerates on the token. You'll see on the top right here, there's a countdown. This is a time-sensitive component due to the two-factor authentication, so you want to ensure that this is done timely. And once you click sign, this prescription is then sent off to the pharmacy. This is only for controlled substances. You won't ever have to do this for legend prescriptions. That is all for prescribing. The next thing I want to show you, or the last thing I want to show you all, is the history piece. We have the ability to see prescription history for the entire facility. So if you go into this top left hover menu, you'll be able to see history, where you can see the prescriptions that were sent off, the time and date stamp. You can filter this by provider and by patient. Any prescriptions that were undelivered will also show up here. The most common thing we see in terms of undelivered prescriptions is a pharmacy server error. We do try to send that prescription off a couple more times, but if you're ever having issues sending off a prescription, our 24/7 support team can help you 365 days a year. And that number is 866-263-6512, and it's at the end of this presentation as well. Thank you all for your time. Liz, do you want to take it away?
Thank you, Aisha. Let me first turn to Megan and see if there was something else she wanted to highlight here before we move forward to asking Drs. Kaminsky and Chen for their input. Megan?
Yeah, hi everyone. So Aisha did a beautiful job giving you a tour of iPrescribe. I would say from a registration perspective, you can always visit iPrescribe.com as well as the support number that Aisha provided. And we have step-by-step what you need to do in order to self-register and set up your account. So I suggest you have things like your MPI number, social security number, driver's license, ID, or passport. If you don't have access to those, we can accept questions about credit history and then access to your email. So having those four, I guess like assets or access will just make self-registration a pretty smooth process for you. So I just wanted to note that there, and that list is again on our website, or you can call us at any time and we can walk you through that.
Super. Dr. Chen?
Hi. I think the good thing for membership to know is this app will satisfy all the state EPCS and PDMP mandates. Our technology is very sophisticated, but it looks fairly simple. But If you do the right thing, they'll automatically check the PDMP once you click it and record that action has been taken. So you're perfectly good to go. You don't have to prepare any more further report for the state. During the multiple stage of the prescription writing process, you saw there's different area you can click to check PDMP and will keep you in the workflow and will not slow you down. A couple of big complaints always been the signing up process, and we try to make it as clear, as smooth as possible. But again, like Megan says and Alicia says, we have 24/7 support, and that's 100% satisfaction rate. So anybody have any questions, just please feel to call. In my personal experience, my biggest problems, I don't use it often enough now. Even I do a lot of surgeries, my opiate prescription is way, way down. So oftentimes I have trouble remembering the exact process, remember the exact passwords. So I have a cheat sheet, I have a little small piece of paper to write down the process and my passwords. And also for DEA requirements, your secure password needs to be changed every 90 days, I believe. And so when you get the notification, unfortunately, you have to go back and change it. But that's some of the requirement we must do to satisfy DEA requirements. So if you don't use the prescription for a period of 3 to 6 months, you may have a hard time remembering how to do it step by step. So I recommend writing down somewhere secure so you can refer to it easily. But other than that, it's good to go. I think for a physician who use it every day hundreds of times, the satisfaction is very, very high. For us dentists, since we don't use it, we get a little bit rusty. So just try to, use it once in a while to be fresh with it.
Dr. Kaminsky?
Yes, I sort of look at iPrescribe as an insurance policy that I have with me 24/7. Like all insurances, we, not sure when we're going to need them, but when something does happen, we're so glad that we do have it. And, I'm sure we've all had the situation where a patient has called us with a problem and it's, we're not in the office, it's weekend or, even late at night. Using iPrescribe, first of all, I can make sure that they are my patient. There are a lot of people out there that are doing the doctor shopping in order to try to get, opioids and different medications. So, this is one benefit, being sure that they are one of my patients. But then again, even with the legitimate patient, you don't remember their medication history. You don't remember necessarily any allergies that they may have. And again, this is a very powerful application. You can prescribe anything for anyone from anywhere. So, I look at it, as I say, as a very strong tool that helps me take care of my patients when they have an emergency or have a need. As I mentioned earlier, the registration, it's a little bit complicated with the ID Me and some of the things that they're going through. We didn't realize that, they're involved with different states helping with unemployment claims. But DrFirst has worked with them, and we think we have speeded up the IDE component of the registration. So again, as Dr. Chen said, it may take a couple of extra minutes. Once you're registered, you've got this tool with you 24/7, to take care of your patient's needs.
Thank you, Dr. Kaminsky. If we could just advance the slide. I think the next slide really just focuses on the features and functionality of iPrescribe. And I do think we might want to, once we're through the substance of the presentation, go back to the ID Me, the slides that are in the appendix, to just kind of run through those screenshots, Aisha. But again, on average, it's a 10-minute registration process. We have tried and worked very hard to reduce the time that it takes. But then again, there are the steps that Megan mentioned, that there are DEA requirements that we can't do really much with. So we have to comply with them. We have the patient finder feature. We have, and we're very proud of, our 24/7 US-based DrFirst support team, which resolves 100% of the issues. We do track those, the rate of resolution. That's how we know. It will provide you with a 12-month medication history. It's got a lot of AI and clinical decision support for efficient prescribing. And again, a feature that, you know, we're also very proud of is our partnership with the state Inspect program and APRIS, which will help facilitate the in-workflow integration with the state's PDMP. So while you're in workflow, you can double check your patient's prescription access. Next slide, please. Just going to run through very quickly the fact that we have won, that this technology, and DrFirst has won several awards even during 2020. Frost and Sullivan, next slide. The MedTech just for iPrescribe, which we're very proud of. Next slide. Now for the Indiana dental members, your team and leadership have negotiated a 2-year access to iPrescribe for free, and thereafter $10 a month for your members. We will track everyone who downloads an app and go back to the Indiana Dental Association to confirm your membership, and therefore your access free to this technology. After those 2 years, for a year, it will be $10 a month if you're prescribing controlled substances and or accessing the PDMP. Next slide. So why don't we, before we go to ID.me, why don't we, Ed, if you want to take some questions for the team?
Sure. Thanks, Liz. We've had several comment about HIPAA concerns with this being on the doctor's private phone. How can he or she protect himself from HIPAA violations with this information being on the phone? And if he wants his dental assistant, or he or she wants the dental assistant to call in the prescription, how does that work?
So the HIPAA compliance is that all the information stays on the app itself. So nothing ever leaves the app, which itself is secure. If individuals are going to be assisting with your prescribing workflow, once you complete your registration for iPrescribe successfully through ID.me, just call into our support line and give them the staff member's first name, last name, and email address, and our support team will be able to give them their own login credentials, which they can use on their phone to download the app.
So Liz, I'm gonna push back just a little bit. So I'm really a simple-minded person. So in my apps, I have a logo on my phone that shows my app. If I hit that logo, it opens it up. Are you saying that on these doctors' iPhones, if they hit the DrFirst logo, it doesn't automatically open up? Is that what you mean by saying it's secure on the phone?
Yeah, what I'm saying is the HIPAA compliance would be if it was, the breach would be if it was, if anything was downloaded onto the device itself.
That's right. Yeah, nothing is saved to your actual phone. It's all in the cloud, and it's encrypted as we secure that information.
Gotcha. So the phone's really just a link to the cloud, and there's security between that link to the cloud.
That's right. And to just another level of assurance is because we do EPCS, we're rigorously, excuse me, audited continuously with the DEA to make sure that we're meeting their standards. So that's why there's that added token. Even when you do the controlled substances, you have to take those additional steps to ensure you are who you say you are, even when you get into the app.
Are there any contracts that have to be signed starting the third year, or is it a month to month? You can drop out anytime you want to, or how does that work starting the third year?
Just Charlie again.
Go ahead.
We don't have any obligation, no contracts. Anybody want to quit us, they can quit us anytime, no penalty. That's always been our policy. We just want to have a handshake with our colleagues. If we don't live up to your expectations, you can dump us anytime. But you guys have the very, very best contract of anybody in the whole country. No other state would have the free period and the low cost that you guys would have. So you guys did great.
Thank you. I will say this too. I know we probably may have some oral surgeons and some general, and I know mostly general dentists on the call. We primarily did DrFirst because of the general dentists were telling us they're only doing 3 to 5 prescriptions a month. Right. And you do have a module. I'll be upfront with you, and the DrFirst people are here, and I don't mind saying this to them, but you have a practice system right now in your office that probably has a module that you can turn on that will do e-prescription for you. The problem is that's going to cost you, it appears, from $50 to $100 a month to turn that module on, is what we're hearing from most people. We vetted another company that's what their cost was. It was around $65 to have them. It's maybe a little bit more robust, has more bells and whistles. It's going to maybe integrate with your patient charts. But this is the best we can find at the least expensive cost, and they've done a good job with us so far. So I do want to throw that out there. You may want to, I thought you said in the last webinar, there is one other company you do an integration with the patient charts on the practice management system. Is that correct? But that's not the same deal, right? Don't they have to pay the $50 or so a month to go that route with you?
Right, the top system, there's a cost.
Yeah, and we partner with several EHRs. I think Curve is one of them. I think Curve is a dental software that is used quite frequently. And we do have Arcopia, which is a desktop version, which is standalone. Arcopia and has a different separate fee than iPrescribe. But it works in conjunction with iPrescribe. So if you get Arcopia, you can use iPrescribe for free. And it's more of a practice setup, and you can use it on your laptop too. And
that costs around $50 to $100 a month to have that service, correct?
Yeah, it's an annual fee of, I believe, $700-ish or something. I'm not quite sure.
Okay.
Right.
And so,
like you said, since our dentists seldom write prescriptions, this free service is probably the most ideal because we don't need it that much, but still, like Dr. Kaminsky says, we need to have it sometimes when we really need it, we need to have it.
Okay, let's talk about Inspect again. Again, the drug monitoring program in Indiana is called Inspect. Do you recommend them trying to integrate DrFirst with Inspect, or should they try to pull the Inspect reports by themselves? What's your recommendation on integrating? And then my understanding is that you have to do the integration with Inspect directly with them. You inform Inspect that DrFirst is your vendor, and somehow there's a link, but you may have to go through identification process again with Inspect in order for them to know who you are. So you may have to jump through these hoops twice. Is that correct?
So when you do register for iPrescribe, you'll be asked if you want to have that PMP integration or PDMP integration. You fill out your information. We get a ticket on our end where we do the APRIS and integration for you all. And if there's any other further information needed from you, we get that. And then we let you know when it's up and running.
And there's no additional charge to integrate Inspect into the program?
Not currently as it stands.
Do it quick, folks. See, okay. Go back a little bit on the fob, because we had some members sign up and they got their fob and they really didn't know what the purpose of the fob was. Can you, I know you touched on it, but I was answering some questions at the time you talked about it. Could you go over just the fob and the purpose of that one more time, please?
Yep. So the key fob is just the hard token that can be used during when you're sending controlled substances. Additionally, you can have soft token, which is an app that can be downloaded on your phone or your tablet or your laptop. And it's all written out when you're in the registration process. And Megan, you can talk on how they can add that token back in once they receive it in the mail.
Yeah,
Just a second, let me just show you. This is what it looks like. I keep it on my keychain. By pushing the button, it activates it. I get a 6-digit number, which is registered with the pharmacy.
That's right. And as part of the EPCS enrollment process, we basically confirm the address where you would like that key fob sent, and that is sent off to you. And then once you receive it, within the box that you receive, that hard token, there are instructions on how to add that. So you basically go into your settings of your app and you're able to manage your authenticators, and you can add that token by entering the serial number that's on the back. And then you just validate that one-time password that it generates, and then it pairs that essentially with your account. So you're able to utilize that little keychain moving forward when you sign controlled substances.
All right. What happens when Alicia was doing demo, when she signed the EPCS prescription, there's a little area when you click, it says the token. That's where you register the number generated by a little fob. So that's part of the signing off process for prescription controlled substance. So you need that little fob for the number generated to finalize the transaction.
So you can either do the fob or you can do this other, there's two different ways, right? There's what you get a number. Describe the non-fob way. What's the non-fob way?
That would be to have an app that has a soft token. A soft token can be downloaded on your laptop or on your phone or your tablet. So the DEA recommends not to, or I'm pretty sure they mandate not to use the same token on the same device you're prescribing from. So which is why we send you that hard token. But you could potentially download it on another phone. So say you have two phones, you could download the soft token on one phone and prescribe from the other phone, which is then compliant.
Right. So the fob is much easier.
Yeah, the fob is.
So you recommend the fob? Okay, good, thank you. Multiple providers in the same office, do they each need to have their own iPhone and their own app per provider, or how does that work when you have 2 or 3 doctors working the same day?
Yeah, so they would have to have their own apps, but for providers, for practices that have multiple providers, I recommend that you all call in or contact one of our sales team. You won't have to pay anything extra. It's just that we need to set you up in a provider setting so that you can connect with each other in the same patient population. Okay.
Question is, okay, let's end this confusion. How do I sign this thing up and how do I get this ball rolling? I guess let me ask this question first. We've got 3 weeks until the deadline. Is it possible that everybody's going to get in the 3 weeks that we have, or are you guys concerned about the volume you're going to be trying to cover in the next 3 weeks to enroll folks?
So this is a self-reg process. It's truly up to you how fast you can work through this. We do provide resources for you to go to, whether it be our support team as well as the ID.me support team. If you're having trouble connecting with ID.me, you can always reach out to our support team where we can expedite the process for you. And it's a pretty intuitive process. There might be a little bit of back and forth. Issues might arise if you have a fraud alert or security freeze on your account. Megan, is there anything else you want to add to that?
No, not at all. I think our support team is very well versed in ID.me, but we have a partnership with them. So any questions you can route through our team and we can escalate those through ID.me. So a majority of this registration process is the identity proofing portion, which involves, we had talked about before, the photo of your license or, questions about your credit history. So if at any point you get hung up there, ID.me is wonderful about setting up an individual time to call you, and they'll actually walk you through that live over the phone so that you don't have to do it so self-service. But again, our support team is also available and is very well versed and can work with ID.me to get you through that process.
And also, as much as we worry about, your membership signing on, the difficulty, our process is still the easiest and fastest in the whole market. We spend a lot of time, effort, try to streamline the process. So you'll find our process, even though it's a little headache and we worry about it day and night, but compared to our competitors, it's really almost like a walk in the park. So we're very proud of that.
Okay, I understand, Dr. Chen. I believe you, but I've also believed I've had a lot of members that struggle, and that 10 minutes is a pipe dream for some of our members. So just be prepared for a lot of, getting your passport out, your driver's license. I mean, again, you're ordering drugs online, narcotics online. So they're going to be very particular that you are who you say you are. So just be prepared. This is not 2 minutes, you're out. This is not signing up for Zoom. This is much more involved than that. So please be prepared. Some of you may not be sharing the chat room. I want to give you this help desk number again. If you got your pencil, write this down. It's also on the question box. If you go to the question box, and they may be able to bring up the screen, 866-263-6512 is the help desk. Again, that's 866-263-6512. Now, to get started, the question is, how do I get started? Go to indental.org, click on official products and services. You'll see the DrFirst logo. Click on that. Then you'll see download the app. And that's where you start. Download the app, and then you just follow the steps from there. Is that pretty much correct, team? Is that the right?
You
to be very direct as to how to sign up.
Yeah, you can also just look up iPrescribe on the App Store. If you have, we should be the first one that pops up. But if you're having trouble, just text iPrescribe to 66866, and I'll give you a download link. So I'll put that in the text box, in the chat box too.
Okay, we're still getting questions on the fob. It's part of the enrollment process, and they're just going to mail the fob to you as part of your enrollment process. Again, there's several bells and whistles to this thing, and there's hoops you have to jump through, so just be prepared for that. But the fob will be mailed to you as part of your enrollment process.
Yep, and as you can see here, during the process, we do confirm your address in order to send it off to you. So it is right here where your information is entered. So right here, it'll ask you for your mailing address to ensure you get the free code generator or the token, and it'll be sent to that address.
Okay, we're still getting questions on the multiple doctors. I know we've gone through it once, but could you please explain again very clearly, if you have more than one provider in the office, how that works with the phones? Does each one need to have his own phone, or he or she?
Yeah, so if you have multiple doctors, I suggest before you even register to call into our support team, where they can direct you to a sales rep and have you set up in a more practice-oriented setting.
So does that mean more than just one iPhone can service the whole office then?
No, you'll still need your own phone. You'll still have your own login credentials. It's that your patient population will still will need to be the same.
Oh, the patient population will be the same, but each doctor is going to have to go through his own identification with ID.me and all of that, correct? Every
That's
doctor
correct.
Anybody that wants to order drugs with their CSR registration is going to have to go through with their iPhone on the process.
That's correct.
That's clear.
But they may not have to do ID.me. In that case, they'll have to do EPCS, which is similar. It's pretty much the same process almost.
But they'll be guided through that by someone on the phone or whoever's helping them enroll. Is that correct?
That's correct.
Okay.
But also, if you want, they don't mind having their own separate ID stuff, they can just sign out independently, right?
Yep, they can sign up independently.
Right. So
you'll have two different patient populations though.
Right. So they don't have to sign out through one office. You only do that if you want access to the same patient database. Otherwise, they can just be independent, sign out themselves.
I'm also finding there's some pharmacies that don't even realize that they have to take the electronic prescriptions. Have you guys run into that where the pharmacist doesn't know the Indiana law?
From what I've seen, the pharmacies get more into it than the providers do before they even get started. So most pharmacies are already taking electronic prescriptions at this point. So you shouldn't have any issues in getting those prescriptions sent over.
Okay, I have 303. Liz, was there some more things you want to discuss before we close it down? I'll look and see if there's any more real prominent questions before we close it down, but I want to be respectful of people's time.
No, I will just highlight for you that in the appendix of the PowerPoint, which of course we're going to give back to Ed and he can get it out to each of you, there are the screenshots of ID.me. So that could help a little bit. But again, that support number is there. And we know and we are ready for the onslaught of questions where our team, our implementation specialists and support team are going to get before January 1. So we've tried to enhance the staffing so that we will be able to accommodate the influx of questions that come up. So, and in the interim, let me just thank you all again. You've had a tremendous outpouring of participants here today. We thank you all for your time. And I know Ed's going to make the video of the or audio of the presentation available to you through your website. So,
Liz, I got one more question, then I think we'll close it for the day.
okay.
And again, I'm a little confused about this too. So you can download all the doctor's patient. There's some information cloud out there that recognizes patients by their social security number or something they can down. I didn't understand how you populate the patients into the app without the doctor individually having to enter each patient's name. Could you just cover that one more time for us, please?
Yeah, sure. So when you've been prescribing for patients, if they, were filling the prescription at the pharmacy, there's a record of their formulary information, sharing that information. It's not their social security that's pulling it up, it's their pharmacy fill data and their formulary information. So SureScripts is the network that we use in order to share this patient data, and that's where you'll see your patient history come in from.
Well, how do you know those patients are with Dr. Smith? How do you know that these 1,000 patients go to Dr. Smith?
Because Dr. Smith has previously prescribed for this patient.
Electronically? But what if he hasn't done electronically?
Yeah, whether or not it's electronic or not.
So all that information's already out there.
Yep.
Holy smokes.
But Ed, I think
Welcome to Big Brother.
I think what you need to do is, as a new patient, you need to enter the patient's name, phone number, gender, birth date, I believe. Then all the data will come up. But you need the basic information for that particular patient.
So you
Exactly.
do have to enter the initial information on the patient, at least some identification of the patient.
If it's not showing up, if the patient finder. Megan, do you want to clarify this a little bit more?
Patient finder, based on what Aisha was just explaining, that association, if you've prescribed for them before, associated to your MPI number, we can say that you have prescribed for these patients before. So we found, say, 100 of your patients. We will automatically load those. If you at any time wanted to manually enter that information, like Dr. Chen was saying, you would have to enter, the name, zip code, date of birth, address line 1 for controlled substances, a DEA requirement. So you could always manually add that. But if you also have the list of all of your patients separately, you could call our support team and they can load that for you. But Patient Finder is pretty intelligent and robust. So we find that it not only does it the first time when you log in, but if you enable it, it will continue to do that as you use the app. So as you continue to grow your patient population and prescribe, we are able to pull that information in so you have those patient profiles within iPrescribe.
Okay, good. I didn't know the patient information was linked to the MPI number out there. So that's interesting information to know. So
yeah, and that can be found in this settings area right here. So if you go into the top left hover menu, go down to settings, you'll see Patient Finder here, where you will enable the Patient Finder system.
okay, I have 310, 308. So I want to thank DrFirst. We're going to have an interesting 3 weeks. I've already got tons of questions about electronic prescriptions. It's happening. It's something we have to do. Integrating with Inspect is going to be interesting as well. So doctors out there, good luck with it. DrFirst, we appreciate your time and effort with us and your patience with us, and we'll try to be patient in return as well and see if we can't get this relationship to work out well for everyone. And again, the state wants to do this to track drug abuse and who's ordering and who's picking up these prescriptions, and the state's, I can understand the state's concern. So thank you very much for your time. This will close our meeting. We will have it recorded. You can check our website for the recording later on. Have a good weekend, everyone.
Yep.
Bye-bye.